everyone, it's Sarah with RegisteredNurseRN.com, and in this video we're going to go over a new nurse tip about dealing with the death of a patient. As a nurse, it is inevitable that you are going to deal with the death of a patient. It just comes with the territory of the job. I love this quote that I heard, which summarizes the nursing profession. As nurses, we're there to open the eyes of our patient, and we're there to close the eyes of our patient. In what other profession are you allowed to do that and to be there during those moments? So in this video, I am going to give you my personal experience with my first death as a new nurse, and I'm going to go over some tips on how to prepare you as a new nurse, how to deal with this. Because in nursing school, they can only prepare us for so much. And this is just a real world experience of something that you just have to go through to build upon, to know how to handle in the future. So first, let me share my first experience with you. I was a nurse for about 6 months, so I was a new nurse grad, and I knew that dealing with the death of a patient was going to be inevitable, but I would have liked it to happen after a year of being a nurse instead of 6 months, but it happened. So my day started out, I had a patient who was in hospice care. Hospice care is where you help a patient, make them comfortable as they are dying and have, the most comfortable death as possible. And the patient had family members, and the family members were very adamant about keeping the bedside heart monitor on so you could see her heart rate and her heart rhythm. And the patient was dying. She was probably going to die that day. She had the telltale signs of death was approaching. And every time the patient's heart rate would start falling, the patient's family members would start screaming out, "Mama, no, don't leave us!" and getting really emotional. And then her heart rate would start to climb and go back up. And it was like this went on for several hours. And it was like it was prolonging the death of their mom. But eventually her heart stopped and it gradually went down and she died. And whenever this happened and they seen that, they became so emotional and were screaming and crying and everything. And it was a very emotional experience. I was crying. Patients on the floor were wondering what was going on in that room. The other nurses were wondering what was happening in my room. And so for my first experience, it wasn't something I expected. And I don't know how I could have prepared for it, but it was very emotional. So I want to share with you some tips on how to deal with this the best you can. Now, like I said at the beginning, all you can do is try to prepare for this and go listen to other nurses' experiences and try to take away from that as what you can. Now remember, it is okay to cry with the family members when your patient dies. This lets them know that you cared about their mom, their dad, their spouse, and lets them know that you're human. But one thing is that you don't want to let your grief overshadow their grief. You want the grief that they're having to be the main thing. Next, here are some tips of how you can support the family while the patient is dying. Because normally what happens is you have the patient and then you have a lot of family members in the room with the patient. And some important things you can do is listen to the family members. Ask them questions about memories that they have of their mom, their dad, and let them reminisce on that. That helps them cope and remember their parent or spouse or whoever this family member is. And try to accommodate their requests within reason. If they feel like the patient's in pain, try to get some more pain medicine for them. If they feel like the patient needs to be turned more often, they're uncomfortable, do that. Try to accommodate their requests and let them know that you care about what they're going through. Next, try to involve them as much as they want to be involved in the care, such as teach them how to do mouth care. If they want to help you bathe the patient, if they want to help you turn the patient, let them be as involved in that care as possible because these are the last memories that they're having of this patient. Next, educate them on what is going on, what's happening. A lot of people they don't know. They don't deal with this every day. They've never probably been around someone who's dying. So they're in the dark and they may be too scared to ask questions. So just let them know as much as they want to know. Some people don't want to know, but as much as they want to know about what's going on, and let them know, you know, we don't know when a patient's dying, but there are telltale signs that can let us know. So share those with the family members. And next, encourage them to talk and touch the family member who's passing away. Many people are absolutely scared. They don't know, would it be wrong for me to talk to them? Would it be wrong for me to caress their forehead or to touch their arm? Is that weird? And just let them know that it's okay. That's a part of them coping with what's going on. Next, if you have this experience as a new nurse, because every experience is different, and you have any questions, chances are you have a shift leader, you even have a house supervisor or other nurses on that floor that have experienced this. So go to them and ask them, what am I supposed to do? Because I remember my first time when my patient died, I had a nurse who helped me with this thing. Because after the patient dies, there's some steps you have to do, and it's based on your hospital protocol of what you have to do to prepare the body to go to the morgue and things like that. Next, remember, people deal with death differently. Okay, that first experience I shared with you, the family was very emotional about it. Now another, on a flip side, I had a patient who had passed away and no one was in the room with her, but her husband was coming to visit her. He had been at home, and I let him know that she had passed away, and I told him, you know, you can spend as much time with her as you want in the room, you know, to let him grieve. And he just looked at me and said, why would I want to do that? She's dead. And just walked off and didn't go in and whatever and say bye. But that was his way of dealing with the death. See, the people at the beginning that I told you about, they were very, very emotional about it. He dealt with it he didn't want to see this, he didn't want to deal with this, and that was his way of coping. So expect different responses from different people. And at the end, whenever the patient does die, offer the patient's family as much time to spend with the patient who has died. And also provide privacy for them and have boxes of Kleenexes available, any snacks, any drinks, anything like that. And if your unit has like a special room, have that room available for them so the family members can go in, console one another, and talk, and allow them to take care of their grief as best as possible. So that is some tips on how to deal with the death of a patient. As I said, as a new nurse, this is inevitable. It will happen, and so hopefully this helped give you some ideas how to be prepared for it as much as you can. And be sure to check out my other new nursing tips. And thank you so much for watching, and please subscribe to this YouTube channel.